It seems like it's been 40 weeks since you got 40 winks. Your back pain? Unbearable. Tossing, turning, trying to find that pain-free position. And that's the moment you realize you can't spend another waking moment putting off treatment.
The Joint and Spine Center is Cincinnati's leading destination for spine care, with a ton of surgical and non-surgical treatments for back pain. So when a moment has the power to change the rest of your life, go to the one place with the power to change it for the better, the Christ Hospital Health Network. This changes everything.
The Pound This podcast is brought to you by Sway, artfully crafted, ready-to-drink cocktails from Mad Tree Brewing. This is episode 780, Foot and Ankle Listener Q&A with Dr. Jeffrey Wu.
I want to lose weight, but I don't know how to get started.
What should I meal prep every week?
How do I get those sweet booty gains?
Inspiration for your healthy lifestyle. The Pound This Podcast with Amanda Valentine.
What up, friends? Thank you so much for listening to the Pound This podcast. Before we get into this conversation, answering your questions about foot and ankle and leg issues with Dr. Wu, I want to tell you about my health coach since 2020, Sarah, and Team Fit With Me. Sarah has her own health and wellness and weight loss journey. You can find multiple episodes of her on this podcast, which is amazing because she found her coach through this podcast in 2018, which changed her journey to becoming a full-time health coach, which is amazing. And Sarah and her whole team of people are awesome. Whether you want to lose weight, you want to gain strength, you just want to be healthier, you want to know more about hormonal issues, you want to know about your autoimmune diseases, she can work with all of that. It's great to have somebody that's accountable, somebody that you can learn from. So if you're interested in health coaching with Sarah and Team Fit With Me, go to teamfitwithme.com/poundthis to save 10% off month one of all packages and plans. And you can see Sarah in person as we record a live podcast at my Pound This party Saturday, August 6th, happening at Mad Tree Brewing in Cincinnati. I am so hyped about this event. It is so freaking close. We're going to have 3 live podcasts, one being with Sarah, one being with Lindsay Bonadonna, where we're going to talk about the lies that we tell ourselves and believing in ourselves, a lot of like mental health affirmations. We're going to do some breathing exercises and an amazing conversation with Rochelle Fraboda about knowing our own bodies, how to get pleasure from our own bodies and relationship issues. Rochelle is an amazing sex educator. Plus, it's my 40th birthday. We're going to have some sways, which are vodka sodas from Mad Tree. We're going to have a delicious lunch. 80 Acres Farms is going to be a part of that. Some delicious snacks from Whirlybird Granola, also from Hen of the Woods, also from Laura's Healthy Delights. She is providing the birthday snacks or the birthday cake, which is going to be a raspberry cashew chocolate bundt cake. Everybody is going to get one of those. Everyone will also get a free $88 pair of leggings with their tickets. It's going to be great. I mean, we're going to have so many different things, a variety of guests. My friend Jay Cruz is going to be the DJ for the day. It's going to be amazing. Vendors, lots of stuff. And it's from 9 to 5, 4 to 5 being the happy hour. But if you want to, just pop in the afternoon and stay for the happy hour, great. If you can only come in the morning and you need to leave and you want to get your goodie bag, fantastic. You do need to get your tickets in advance though. And the link for the tickets are in the show notes. Use code TCH to save $20 off of your ticket. I really hope to see you at my Pound This party celebrating almost 5 years of Pound This. Would be amazing to see you there. Okay. Speaking of Christ Hospital, who's going to be there with the med spa, and we're going to have pelvic floor PT, all the things. Let's talk to Dr. Wu now from the Christ Hospital Health Network. Thank you so much for listening to the Pound This podcast. I am Amanda Valentine. My guest today is Dr. Jeffrey Wu from the Christ Hospital Health Network. How are you?
I'm fine. Thank you. Thanks for having me.
Yeah, I'm excited to chat with you because there's so many foot and ankle and just leg issues I feel like everybody has, whether you're physically active or not, including myself. And being an orthopedic surgeon, I'm hoping that you have some good answers for us. Is this what you pretty much deal with on a day-to-day basis?
Yes. Yeah. I'm an orthopedic surgeon. I did a fellowship in foot and ankle surgery. So that's the primary focus of my practice, is dealing with all of these foot ankle issues.
So what got you interested in doing this area of medicine?
Yeah, I started out in college as a engineer and went to medical school not really knowing what I would do. And it's interesting that what I do now kind of fits, but really wasn't like a long-term plan. Just kind of the mechanics of things. And I think there's a lot of problem solving and thinking that we do every day, and that helps because every patient comes with their own unique issues. I feel like it's a lot of playing detective and trying to just figure things out for people.
So how long have you been at the Christ Hospital?
I've been here for 7 years. Prior to this, I was in Indianapolis, but Cincinnati's home for me, so kind of in a long route, made it back home.
That's awesome. It feels like a lot of doctors I chat to aren't from Cincinnati. The job brought them here, so it's fun that you get to like come back home.
Yeah, I mean, it was definitely a job bringing back, but it all kind of worked out very well. And family's good to be here and have everybody around. So
awesome. Well, I do have a bunch of questions for you. This kind of all sparked where I got an email, somebody asking me this question, and I'm like, oh my God, I do not have the answer to this. Let me see if I can find somebody who does have the answer, and that would be you. And she said that she's noticing with her feet when she takes a long walk that she tends to get foot and toe and cramps late in the evening when she's sleeping. She said that she's trying to drink plenty of water, but she doesn't know if it's a blood circulation thing. Like, why is she having cramps and some pain in her toes and feet and legs from walking? Like, what would that be and what can she do?
Yeah, cramps are one of those somewhat unknown things. I think it does tend to be in people who are active, doing a lot of walking, running, jogging, that kind of thing. There are more medical issues that can be related. My guess is with your listeners, a lot of people are trying to stay active, and it's usually related to that. Traditionally, hydration, was always an important part of it. Part of the thought about cramps is more electrolytes, and I think potassium is kind of high on that list of making sure you have enough. I think there's lots of other things out there, which I don't know that anything is truly proven, but if you ask around, someone will say they tried this and it worked, or they tried that and it worked. So I think that the more definitive things are things like potassium. And so people do often say, bananas are high in potassium. That's always good. The hydration is important. I think in the past, people would drink tonic water, which I don't know that I ever have myself. But tonic water has quinine in it, which I think it's kind of plus or minus on where that works. And certainly people have tried it in the past with success. So
is this something that would be worth her getting a doctor visit for, or just kind of trial and error on her own?
I think most of the time it's trial and error. I think especially if it's someone who is fairly active, it's certainly just with activity, you're naturally going to be a little bit dehydrated. And even with staying hydrated with water, that doesn't necessarily replenish things like sodium and potassium either. If it's something that really becomes more of a problem, is really interfering with like sleeping and that kind of thing, then certainly seeing your physician would be good to do. I think there are some medications out there, for example, like diuretics, which people use for blood pressure control, and even they call it a water pill. So in a sense, you're getting dehydrated, right, by taking that. So a lot of it depends. I mean, if you have medical issues like blood pressure or cholesterol, some of the medications can cause it. Again, going back to your population, I think that they're probably more active, and I probably wouldn't start with that. Some things we say, oh wow, if you hear that, you got to go see your doctor. I mean, this wouldn't be one of those types of things that I think people would jump to say, wow, you have to go get evaluated right away.
Gotcha. So, and something similar, I'm curious if related, a personal problem I've had in the past. So walking, fine, no issues. Even I used to run a lot, fine. But the moment I get like on an elliptical, my feet will go numb. And like, it's just like, I've had that a little bit on a treadmill, but like specifically like a machine like an elliptical, I'll get numbness in my feet. Now, is that somehow somewhat related, or is it just because you are like in a planted position with your feet and it's pinching something weird, or what's that about?
I think that with all the different, it's one thing if it's a certain activity that causes it. If every activity causes it, you'd definitely be worried about circulation type of issues. But beyond that, I think ellipticals, they kind of force you in a certain position in terms of your overall alignment. I think that some ellipticals really, they're kind of built for everybody but nobody, in terms of your stride length and everything. And even though you can make little adjustments, it question becomes, where's the numbness? Is it just in the toes? Is it your whole leg? Is it, that kind of stuff? Is circulation kind of issues will be very predictable. I don't think it really matters what activity. It'll be, if you go 5 minutes and you get some numbness, tingling and stuff, you just have to stop. Everything comes back, and it's very reproducible. It doesn't sound like that's what you're dealing with either.
Yeah, it was just odd. I mean, the elliptical isn't my favorite thing to do in the first place, but I think that especially for me, like starting a health and fitness journey, my default, if I did go to the gym, was just to hop on the elliptical, and then my feet would go numb. And I'm like, oh, is this because I'm super unhealthy or I'm overweight? Or like, I guess it's just the positioning of it, because that's still an issue for me with, I'm super active with walking and movement. But it feels like that's one of those, like, so I don't really get on it because my feet go numb, but I just was wondering like what that is. And I guess it's just the way that how it shifts me. And I kind of get the same thing with a treadmill too, because I feel like I walk differently on a treadmill than I do just like walking down the sidewalk. And I guess it just forces me in a position where it makes things move in a way they're not supposed to.
Yeah. I mean, there are entities out there, for example, if you had a back issue or something, but there's something called tarsal tunnel syndrome, where it's similar to carpal tunnel, which most people are familiar with, where the hands go numb, from writing, typing, activities. Really not as common in the ankles, but the nerve goes down the inside of the ankle down towards the bottom of the foot. And for things, if it is something that you just can't get past, sometimes using arch supports, orthotics can kind of, it's positioning, right? And I think for most of these things, there's a lot of mechanics. If there are simple things you can try and make a little adjustment, it's always a little bit of trial and error. If you find the right combination, then you're good to go. If not, then you may have to dig deeper.
Well, that brings up a really great question, a question that somebody else asked. Leading it into me, though, I've used orthotics before, and those make my feet cramp because I have pretty flat feet, and I feel very comfortable in flat shoes as opposed to wearing something with arch support, which I've gotten conflicting things from physical therapists and doctors on whether or not I should have arch support. But that is something that makes my feet cramp and feel uncomfortable. And somebody specifically asked, what support do I need for flat feet? So is that something you get past the cramps if your, inserts are doing that for you? Should you wear a flat shoe? Or is it just one of those things that's case by case basis?
It's definitely case by case, but I think the first part is, if you have flat feet and you don't really have any issues, you don't necessarily have to do anything. So it's not, if you have flat feet, you have to have inserts and torture yourself because they're not comfortable. I think there is kind of this breaking in period where your feet do need to get used to them. But the question is, why you're using the inserts. And typically it's to solve a problem or help with a symptom. So if you don't have any, you don't really have to. I think orthotics are all across the board in terms of quality. And, there's things that you can just buy at the drugstores. There's custom made. There's a lot in between. I tend to tell people to go to a lot of their running stores and that kind of place because there are a lot of better over-the-counter options nowadays than there used to be.
Yeah, I know I've gone to Fleet Feet and they do the feet scan, and that's been helpful for me. And that's where it's like, it also just depends. Am I standing all day and what feels comfortable wearing that versus what I'm wearing if I'm running or walking or working out. So I think that has made a difference, at least for my flat feet, because if I'm standing, the arch support's fine, but if I'm doing a lot of movement is when it'll make it cramp up. And so I have two different kinds of shoes depending on what the activity is. So I personally found going to like Fleet Feet very helpful. It's expensive to get multiple pairs of shoes for different activities, but it's better than, having to get foot surgery down the line, I guess.
Right. Exactly. No, I think that they do a good job there. It's a combination though. You've got the actual shoe itself, and then you've got the inside of the shoe, whatever your foot is contacting. And I think both of those issues are important, depending on, what exactly the problem is. So
speaking of feet and Fleet Feet and running shoes and stuff like that, I had a lot of questions that people wanted to have answered about plantar fasciitis. So I guess I want to start by saying, what is plantar fasciitis and what causes it and how can we prevent it?
Yeah, I mean, plantar fasciitis is, I guess, the closest to try to help people to understand. It's more of a tendonitis, if you will. It's actually more of a soft tissue disorder than it is what people used to actually term heel spurs. So I don't like to use that term because it really isn't a bone problem. It really is in active people. So runners, joggers, people on their feet all day, and then even different kinds of employment, teachers, nurses, retail, that kind of patient. That's what plantar fasciitis typically is. It is actually probably the most common thing people complain about, but it's also one of the more frustrating things because there isn't one thing to do and then you're done. And it can also go on for a while. To me, the most important thing actually is a lot of stretching. The plantar fascia goes from the toes, connects to the heel, and it's really somewhat continuous all the way up the calf. So you're really not necessarily stretching just the arch, but it actually is more like the whole ankle and the calf muscle. It's one of those where people, if you ask around, just like with the leg cramps, hey, I tried this, I bought that, or I did that exercise. But I try to have patients do a lot of stretching, and it's not doing it for a long period of time. It's frequent stretching throughout the day, even if it's 3 to 4 minutes, 4 to 5 times a day. I think cumulatively that's still less than if you just did 20 minutes straight. That frequent or intermittent stretching is actually more effective for most people.
So what kind of stretching would you recommend? The first thing that pops in my head is just rolling your foot over a tennis ball. That's always gave me some relief from foot pain.
Yeah, no, I think that's helpful. That's more like kind of the soft tissue massage aspect. I actually have people try the tennis ball or even like a frozen bottle, and so you're kind of massaging the foot and rolling it over, but also icing it at the same time. I've seen some stuff out there online. It's almost like almost looks like a deodorant roll-on ball that you can put in the freezer. It has a little base on it and you roll your foot over it too. But from a stretching standpoint, I think the two best ones are, if I can try to describe it, like standing up against the wall with one leg back and then leaning forward.
Okay.
If that makes sense.
Mm-hmm.
And then the other one that I like is if you're standing on a step with your toes are on the step and your heels hanging off, and then you're letting the heels kind of drop down, with gravity. To me, that's the best because you're using your body weight. It really should be easy if you just relax and let things stretch. You're not going up and down. You're just trying to let the heels drop down to the floor and really stretch out the calf. And again, holding it for 30, 60 seconds at a time, but repeating that for a few minutes each session.
So are these stretches you want to do preventative before you start having issues or after or both?
I mean, it's definitely something to do if you're having issues. I don't see a lot of downside to doing it more preventatively, but I don't know that it's necessarily proven how much it helps. But it's one of those, as we were kids growing up in gym class, everybody said stretch, and it was kind of just you just go through the motions. But as I do this longer and longer, I do see that it is more and more important because stretching the calf and the lower leg, I mean, everything is connected. So people with tight calf muscles and Achilles tendons, they tend to have tight hamstrings also. So, it's probably a good idea to do, especially for people who are active and doing things on a regular basis. I think we do encourage that to prevent, I guess, you have overuse injuries, and then you have things kind of the weekend warrior type of injuries. I guess the most common would be that I see would be like people who tear their Achilles tendon. That tends to be, I just went out on a weekend and played some basketball with the friends and that kind of thing. And it's not a regular occurrence. So that does come up as well.
I just hate that stretching sucks so much. Like I understand the benefits, and I'm also one of those people who have very tight hamstrings, and I got all those issues, and I've been to physical therapy for a lot of stuff, and it's just like, you do that daily stretching, and I'm like, I don't know why I hate it so much and why it's so hard to do. Like, even to like begin and end a workout with it, it's like, oh, I just want to get to it. And I have that problem because I used to run a ton, and I wouldn't stretch at all before and after, and I don't know why. It's just, it takes a couple minutes, and like everything in my brain screams at me not to do it. Like, I don't know why we're like this.
Yeah, nobody wants to do it. And for that reason, I mean, I don't tell people necessarily to do it as a preventative measure. But usually the people I'm talking to are having problems, right? So it's like, hey, come on, just add this a little bit, to your routine. And that's why I try to have people kind of get in that mentality where, look, you just have to do it a little bit at a time, right? If I tell someone, wake up and stretch for 30 minutes every morning, they're never going to do it.
Yeah.
And on top of that, I don't think it's as effective. So trying to get into that, it just takes a little bit of effort, I think can go a long way. But you're right. It's one of those that you just go through the motions and it's just like a punishment almost.
Yeah.
But
well, and I've learned the hard way too with those things because of blowing past stretching so much until I get to the point of injury where it's like the only thing you can do is just stop and rest. And that's made me more nuts than just trying to stretch a little bit. So it's like, but even though I've learned that lesson still, it's like hard to incorporate that sometimes. So like a solution that I had, like a workaround, knowing myself that I'm like, when I have these like muscle aches or I do it too much and I for some reason won't make myself stretch, I did get like a Theragun. I got one of those like for Christmas. And my PT was like, yeah, do that. And I'm like, yeah, I'll massage my leg. Like I will do that motion. But if you ask me to like just stretch the leg, I won't do it. So it's like finding those tips, like those tricks to work around your own brain where it's like, if I see it as a massage, I'm down. But if I see it as stretching, I don't want to do it.
That's right. Right. It's all mindset.
Yeah.
But yeah, at the same time, I think if you're active and you're not having any issues, then none of these things come up. And so you have to balance that, I really want to keep doing this, but I can't if I don't change something. Right.
Yeah.
So it's kind of that finding that sweet spot where there are exercises you'll do and you'll tolerate it and they're not too bad. Understanding that I'm doing this so that I can do all the things that I want to do and enjoy and stay healthy and that kind of stuff.
Well, speaking of stretching, one of the questions you also got was how to improve ankle mobility. I'm assuming that's just another drill of stretches for that.
Yeah, I mean, I think that's a harder thing because it's not like if you truly don't have flexibility or there's like it won't go as far. I mean, I don't know that there's much you can do to necessarily physically make your ankle more mobile. That's one of those where if someone really has an issue, there's probably more going on. Either they have really high arched feet or even flat feet. I think that kind of puts things into a more of a different category in terms of, I want to run, but I don't have mobility, right? I guess that's one where if it physically doesn't go, you could stretch all day. There's more of an issue that probably needs to get looked at.
Well, the next question was how to strengthen ankles prone to rolling. Is that kind of fit into the same category with that?
That's probably a slightly different one. I mean, the kind of the structural problem that people have a lot of rolling the ankles. Some people tend to have fairly higher arched feet, which there's not much you can do there. But the more common category would be someone who has sprained their ankles before, and it just becomes kind of a chronic problem. And essentially, if you sprain an ankle, you've torn some ligaments. Just because you've torn them doesn't necessarily mean your ankle is just going to fall apart. The key with that is rehabilitation and getting the muscle stronger to kind of compensate for the ligament issue. If you truly are, with most steps, if you are turning your ankles once a week or every day, that might be something called instability, where sometimes you do need to go in and have the ligaments reconstructed. But usually all of that is centered around having had injuries before, is usually what kind of starts people down that road. So if I have younger patients, first time sprain, I do try to push getting to physical therapy to really get the strength back. But a lot of it is kind of retraining the ankle and getting the balance and that kind of stuff so your foot responds appropriately if you're stepping on something or just walking.
Well, like a lot of these things that we discussed, it seemed like you can stretch at home, you can do some mobility on your own, you can experiment and figure out those things. So when is the time, if you're having foot and ankle issues, where it is time they're like, okay, I have to go see a doctor? Is it just like the searing pain, or is there things to like watch out for?
Yeah, I mean, I think for most of what I do, it's two things. It's pain and function. And especially active patients, if it's a very like every step hurts kind of thing. You worry about things like stress fractures. I think that would be something to just get that looked at. If it's an intermittent thing, such as like plantar fasciitis, where it's all activity related, I think it's fine to make some adjustments. Look online, it's fine. That's out there, and you can find some information. But I guess the more important thing is, what's your functional level? Where do you want to be, and where are you? And if you just can't maintain what you want to do, first step is usually rest and kind of take a break. But if it just continues, then you have to get it kind of looked at to see. I certainly have people who just kind of give up a little bit, and they come in a year later and say, I haven't run in a year. Now what? That kind of stuff too. So really, I think it is a little bit kind of personal situation. Trying to find the right amount of activity, the right amount of stretching, the right amount of adjustments. How you don't have to spend hundreds of dollars on shoes and inserts. If you're doing that, you probably need a little bit of instruction or direction on where to go with that.
Yeah, I think that's just super helpful, because I feel like, and myself included, like once you start to feel some pain, you're like, oh my God, I'm neither done for. I'm afraid to ask a doctor. They're going to tell me to stop and do all these things. But I feel like so much of our conversation, like I mentioned earlier, is just, hey, stretch, hydrate, do some trial and error and fix those things. And to me, that feels very relieving, instead of going to like worst case scenario of I'm going to have my feet removed.
Right. That's right. Yeah, we don't do that often.
That there's just so many things that we can do on our own, and then kind of just know, okay, well, if these things aren't working, then I can go somewhere and get some help. And it's probably not going to be this like worst case doomsday. They're never going to tell me to run or to like move again. And I feel like that's just what stops so many people from taking care of themselves, like this fear of somebody's going to force me to hard stop or do something that I don't want to do. So I'm just going to ignore it. And then I feel like that just leads to more and more problems. Like you said, then you should end up showing up a year or two later and things are worse, when you could have just done some stretching and some hydrating and figuring out some problems earlier on, rather than just ignoring it until it becomes, unmanageable.
Yeah, agreed. I mean, I don't think that for every little thing you have to stop and go make an appointment. I agree with that. It really is kind of the question is, when is it bad enough to say, all right, it's time to kind of look at it? And there's lots of things to try first, kind of being reasonable with the activities. But a lot of it is just, it depends. If some people come in and they know all about plantar fasciitis, and they just want to confirm that's what it is, rule out the bad stuff, stress fractures and those kinds of things. Some people just kind of want little tips on how do I keep going, and every situation is different. But a lot of it, it's almost like a therapy session. It's like, well, let's figure out, like, why do you hurt? What do you want to do? What are your goals? What are your activity levels, and where would you want to be, and where are you now? And that's kind of, it's really not the same recipe for every single patient.
So with that being said, are you accepting new patients, or can people send you an email and ask some questions, or how are you available? We're always accepting new patients. With, people get injured all the time, and we try to set aside some slots for, same day kind of stuff. I know that at least through our medical records, patients send us what are called my chart messages and that kind of stuff. And that's kind of like the medical email side of things. We have that. I think the things like plantar fasciitis and Achilles tendonitis, which we didn't talk too much about, is very much a similar entity. Those are like my top two handouts that I give out. And so sometimes someone will come in for their own issue that's unrelated, and they're like, oh, by the way, my husband or my wife has heel pain. I'm like, oh, here's a handout. Just take this and study it first. But it is that common. Awesome. Well, this was super helpful. Lots of great information. Hopefully helping everybody that asked those questions. So Dr. Jeffry, thank you so much for your help today.
All right. Well, thank you very much.
AmandaValentineBites.com